Our top story tonight, and exactly how the coronavirus transmits itself between people is still one of the big unknowns for the experts. Our correspondent Paul Kelso has been looking at what we know so far.
This is the Wuhan novel coronavirus. Now, coronaviruses are a large family of viruses that can cause illness ranging from the common cold to more severe outbreaks, such as Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, known as SARS. Now, this strain, called 2019 novel coronavirus, or nCoV, has not previously been identified in humans, so there's no vaccine, humans have no immunity, and the virus is able to mutate, making it hard to control. Signs of infection include respiratory symptoms, fever, coughing, and breathing difficulties. In more severe cases, infection can cause pneumonia and even kidney failure.
What we don't know is exactly how pathogenic this virus is. In other words, just how destructive is it if you get the virus and go down with pneumonia. There are no specific treatments for this infection, and so clinically the objective is to isolate the patient so that they cannot transmit the virus to anyone else, and also to stabilize them through that critical period when their lungs are not functioning well and they're simply not getting enough oxygen in.
The outbreak began in Wuhan, a city in central China, roughly the size of London, with a population of around 11 million people. And the whole city is now locked down. The market where the virus was first passed from live animals to humans has been shut since the start of January. And the city's 3 major train stations are closed. All departing flights have also been grounded from the city's international airport, which has links to 60 overseas destinations. Other cities are taking steps too. Nearby Izhou has closed railway stations, and Huanggang is imposing similar controls on its 6 million residents. But the virus has not been contained. At least 4 cases have been reported in Thailand, the most outside China, 2 in Vietnam, and at least 1 in each of South Korea, Japan, Taiwan, Singapore, Saudi Arabia, and the United States. All of those affected are either Wuhan residents or had recently visited the city. Now, governments around the world are imposing health checks on people flying in from China, but these are not foolproof. The virus incubates for up to 5 days, meaning people can be spreading infection without knowing they even have it.
Paul Kelso there with what we know so far. Well, I want to find out even more because I'm joined by Dr. Rosalind Ego, the Assistant Professor at the London School of Hygiene and Tropical Medicine. Very good evening to you, Dr. Ego. Now, first of all, your assessment from what we know, and there's an awful lot we don't, of course, is has it already reached the United Kingdom?
Well, it's very hard to say, but we don't have any confirmed cases in the UK at the moment, and they're investigating the suspected cases that we do have now. So until we get confirmation that the virus has reached the UK, we should just keep working under the assumption that it hasn't.
OK, so what assumptions are you working on about how infectious it is?
Well, that's a really key piece of information that we need to get, because we know that the virus spilled over from animals into people, and we know there's been some transmission from those first people to their close contacts. But we don't know if there's sustained chains of transmission from person to person, and we don't know if the virus is easy to transmit. And that's the kind of thing that we really need to know next.
Method of transmission, airborne, person to person, and indeed how many people potentially an infectious person could then also infect.
Yeah, exactly. And so the surveillance that's being done in China and now will be being done in other countries is critical to really understanding how quickly the virus can spread and the characteristics, like you mentioned, about the virus. OK, so they're still to be found out. But does that then also inform the search one imagines there is for potentially a vaccine? Is that possible to develop something like that? So people may be trying to develop vaccines now, and there's organizations that have started trying to fund that. But for now, we need to focus on finding cases, tracing their contacts, and containing it.
OK, so therefore that's what we're hearing with suspected cases in the United Kingdom. You observe and isolate. Is that the basic early treatment?
Yeah, that's what we want to do at first to try and stop transmission. But it's also important, if we find somebody a suspected case or a confirmed case, that they get treatment if they need it as quickly as possible.
And how does this, I mean, we're being told, you know, of the symptoms to watch out for. They sound awfully flu-like. How does this virus differ from a flu virus? What are its similarities and differences?
So it's in a different virus family, but the coronavirus family is, there's a lot of coronaviruses and they infect people and animals all year round, all the time. But this is a new member of the family. And so we don't yet know the characteristics of it. We don't yet know the severity. We don't yet know how transmissible it is. And so it's not similar to flu because it's a different family, but it is a respiratory infection, which is similar.
OK, and so therefore you get these similar symptoms. Are we going to get an awful lot of false reporting, one imagines, because it is flu season at the moment? There must be many, many people with flu who perhaps have come into contact with someone who's come back from China or something like that, are going to start being worried.
It is difficult to distinguish the flu and non-influenza respiratory infections at all times of year. But our public health surveillance in the UK is world class, and I think that they'll be able to tell those apart.
And have you got any potential observations on just how deadly, how dangerous this coronavirus could be, again, compared to flu? We know that flu is, of course, dangerous and people die from it, particularly those with vulnerable conditions. Is coronavirus similar or potentially worse?
So at the very beginning of an outbreak, and that's where we are at the very, very early stages, it's really difficult to know the severity because at first you see the severe cases, the people who become very ill. And you know that there might be other cases, but they're very difficult to find. And so right at the beginning of the outbreak, it's hard to assess that. And that's what's going to be really important over the next couple of weeks to understand the severity of what we're dealing with.
And is another of the dangers that even if it is, let's say, identified, isolated, we don't know, or perhaps you do, how able this virus is to mutate, to develop into a different strain?
Viruses that circulate among people always change a little bit because this is an RNA virus, which is the kind of genetic material it has. And so viruses, they always change a little bit. And so it's very unlikely that a mutation that we see will cause a problem. We keep an eye on mutations because it can help us understand the size of the outbreak and it can help us understand the paths it's taken through the population. So yes, the virus will change, but people are keeping a very close eye on it. And that's a real strength of this outbreak. We're bringing together lots of different kinds of information.